Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of August 5th, 2024. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, after an update on COVID and Mpox, I'll be joined by my co-host, Dr. Kenji Taylor, to field the many questions we've been getting on Ozempic for weight loss. Starting with COVID and taking a look at wastewater, this is really kind of increasingly concerning for this time of year. Looking way over to the right, you can see where we are now, and that black line in the middle represents the national average. The last time we were this high nationally was in February, when we were just starting to come down off of our winter surge. You can see that the teal line and the purple line, those are above the black line. So that means they're higher than the national average. And the teal line represents the West, the purple line represents the South, and those are both significantly higher than the national average and increasing. They're both headed significantly up. Here on the West Coast, our wastewater concentrations of SARS-CoV-2 has not been this high since mid-January, so really right during our winter surge. So for us to be up this high in the summertime is concerning, and the fact that it's continuing to go up and not seeming to level off yet is also concerning. Somehow the Midwest and the Northeast are not doing as badly as the South and the West, and it really is unclear as to why that is, but they are also still heading up, so we'll just have to keep an eye on all of the regions to see what happens next. Taking a look at the map, we can see that almost the entire country is either high or very high, which are in the darker blue colors. For whatever reason, North Dakota is not reporting any data at all, so it's shown there in gray. We can see that only New York and West Virginia are low. That's represented in the light green. And Arizona, Michigan, and New Jersey are moderate. And literally the entire rest of the country is high to very high. Now, before, we used to have a lot more detailed information about what was going on in different regions of the United States, about what strains were predominant in each of the regions, but we have very sparse data about that now, and about how these variants are distributed across the country. So we just don't have that kind of detail anymore. We have more or less a blind spot in that regard. But if we take a look overall nationwide, we can see that the KP.3.1.1 subvariant of Omicron is projected to be the highest and increasing the most significantly. And that's in that teal color there. And that's projected to be almost 28% of specimens. And some of the studies that we've seen on KP.3.1.1 in the lab definitely do suggest that it is more effective at getting around our prior immunity. It's more contagious than the strains that came before it. So this isn't new. SARS-CoV-2 continues to evolve. It continues to become more contagious. Those are the strains that take over and outcompete the other strains. And at the same time, we seem to be doing less and less to try to contain it. So it really shouldn't come as a surprise that we are having a surge, although it is larger than we would have anticipated at this time of year. But one thing about SARS-CoV-2 is that it has stayed a step ahead of us this entire time. We've still not been able to really predict what it's going to do next. So that seems to be the only thing that we can rely on, is that it will continue to surprise us. Taking a look at emergency department visits, we can see that those also continue to head up. And the last time that emergency department visits with COVID-19 was this high was in late January. So again, it really does seem pretty concerning to have this much COVID in the emergency room. What would really be helpful would be to see how many of these are ending up admitted to the hospital, but that's another blind spot that is not being shared with us anymore. But we have seen that time and time again, when wastewater SARS-CoV-2 levels go up, then emergency department visits go up, then hospitalizations go up, and then deaths go up. We do continue to have the death information. Unfortunately, that is starting to head back up again as well. We reached a low point of 300 people dying in 1 week, which is still too many, but 300 people died the week ending June 8th. And since then, we've just been creeping back up. The week ending July 6th, which is the last week that we have complete information for. So it is lagging about a month behind. But the week ending July 6th, there were 421 deaths where COVID was either the direct or contributing cause of death. And this is still quite substantial. This is more than 1,500 people per month in the United States dying due to COVID. And this is summertime and it's already heading back up. So definitely hope there will be a time this year when it starts to go back down. That hasn't typically been our experience so far, but you never know. Like I said, COVID continues to surprise us. But this is still a lot of people dying. It does not seem like an acceptable place for us to be settling in and accepting that this is how it's going to be. But I do worry that that is really, in fact, the message that we seem to be getting, because we just haven't heard anything from our leaders. We haven't heard anything from CDC leadership. We haven't heard anything from our political leaders. We only heard about President Biden getting COVID. So clearly there's a sense that this is something to be concerned about, but we don't seem to be having our leaders directly discussing this with the public anymore or issuing any type of guidance at all. So unfortunately, we've experienced now, I think, up close and personal about how tied up our politics are with public health. And the fact that we're heading into election season is a likely factor in why we're not hearing much about it. But there does definitely seem to be an effort or desire to sweep this under the rug. But when you speak directly to folks in public health, COVID remains the biggest infectious disease concern right now in terms of the amount of sickness that it's causing, the amount of death that it's causing. There's no other infectious disease that is a leading cause of death like this. And this is before we even take into account any of the post-COVID or long COVID impacts that we know is kind of the crisis on top of the crisis as it relates to COVID. So it is disheartening that we aren't hearing much from our leaders about it, but that is why we will continue doing what we are doing here. So we're seeing quite a bit of SARS-CoV-2 circulating in our environment. We're seeing emergency department visits and deaths heading up. And anecdotally, we are seeing a lot of people who managed to avoid infection up until now getting COVID now for the first time. And all of this likely has to do with a combination of factors. One, we have the more contagious variants. And also we have all the mitigations that we could be doing pretty much going by the wayside for the most part right now. Very few people masking, what seems to be very little attention being paid to indoor air quality. No real conversations or guidance from our leaders. And also, we're seeing so much SARS circulating in our environment at a time when most of us have not had a vaccination in a while and are actually waiting for the updated vaccination to come out. So this all seems to be creating kind of a perfect storm where immunity is low across the board. We have a highly transmissible variant circulating around. We've got the usual summertime travel, a lot of air travel, all kinds of travel, more mixing, more spread. Pretty soon, all the students will be back in school with even more mixing and even more spread. And we know that the updated vaccination has been in the works, but it's a little baffling as to why it is not being made available to us at this time. I would think it would make a lot of sense to have the updated vaccine available now or really a month ago, so that for those who were going to travel, for example, they could have protected themselves ahead of time. For those who are getting ready to start school, they could be protecting themselves now, for example, ahead of time. But instead, we've gotten sort of rhetoric really about trying to so-called align with flu. So we want to align our vaccination strategy with flu, even though COVID itself is not aligning itself with flu at all. So this seems silly at best. And it seems like we could have prevented quite a lot of sickness and even death if we would maybe drop this ridiculous notion that COVID and flu should somehow be aligned and instead allow individuals to access the updated COVID vaccine as soon as it can be ready and when it makes the most sense for them based upon their situation, which includes any high risk activity that they may be engaging in, like travel, like school, whatever it may be, as well as knowledge of when we are having a surge in our area. So as we see it's different in different geographies. And so trying to align with something that's completely different continues to just make no sense. So if anyone is listening who's in charge, I hope you'll rethink this strategy or perhaps maybe provide the public with a better explanation because right now the strategy doesn't seem to be based on the reality, which is COVID is not aligned to flu. It is not seasonal. And there are different times of the year where people and communities in different areas appear to be facing greater risk. So we should instead be aligning to that. So sadly, I think we can expect for our current situation to continue the way it is to place an increasing burden on our society. This isn't just about burden in the healthcare settings. This is about individuals missing work, individuals missing school, post-COVID issues that we're seeing, like heart attacks and strokes, as well as prolonged respiratory issues and neurological issues, and a continued burden of long COVID. And this does not seem sustainable. So I'm very hopeful that we will get some better vaccines, we'll get some better treatments, and that things will improve. I'm hoping that we will have courageous leadership at some point that will decide that this is something we should actually be open about. We should be forthright about. We should not be afraid to discuss it or afraid that people are so-called tired of it. We should be facing the reality of the situation and actually trying to improve matters. But in the meantime, let's do what we can to follow our best practices to reduce the spread of SARS-CoV-2. We're going to have to continue doing the best that we can on our individual and household and family and community level. Continue wearing a filtration mask, especially indoors, but also outdoors when you can't maintain enough distance. We are also anecdotally hearing about more outdoor transmission, likely just because of how contagious the current variants are. So even though transmission outdoors is definitely less than indoors, it is certainly not impossible. And now for a brief update on Mpox, formerly known as monkeypox. I reported earlier this year on an ongoing outbreak in the Democratic Republic of Congo. And this outbreak is continuing. It's important to note that this is an outbreak of what's called Mpox clade 1, which is the much deadlier strain of Mpox, which thankfully we have not yet had to contend with here in the United States. Hopefully we'll keep it that way. But this outbreak is particularly devastating. It's a much more lethal variety of Mpox. And in the past, we just have not seen human to human spread like this. We would just see maybe occasional cases that would go from an animal, like maybe a rodent or a monkey, to a child, for example, in a village or a remote area. But this outbreak is spreading for the first time where we've seen clade 1 spreading from human to human like this, including through sexual contact. And this outbreak in the Democratic Republic of Congo has already caused 14,000 cases this year and 450 deaths, including among children. And recently, just over the past couple of days, it's been identified that cases have spilled over into Uganda and Kenya. And it appears there may also be cases in Rwanda and Burundi, but we're waiting for confirmation on those through the sequencing. So both the World Health Organization and CDC have been sort of signaling that they may be ready to put out some new guidance. And in the case of the World Health Organization, perhaps even a declaration around the level of urgency or emergency that this may be. So I'm sure they'll have more to report on this in the coming weeks. In the meantime, it does look like the United States has donated some vaccine. Remember, that's the Jynneos 2-dose vaccine, which we believe should be effective against this clade of Mpox, maybe even after exposure. It is important to note that this outbreak is clade 1, that is different from clade 2, which is what caused the global outbreak that affected us here in the United States in 2022. Clade 2 is milder with a much lower fatality rate. but it still can cause serious illness and death, particularly in people who are immunocompromised. So clade 1, we haven't seen yet in the United States, but has been identified now in several African countries and has been spreading for the first time through sexual contact from human to human. It does have a high fatality rate, so it is important that this be contained. So we anticipate some upcoming guidance on that, and I will report more as we have it. And now I am pleased to pass it over to Dr. Kenji Taylor, who's joining us today to answer the questions that we've been increasingly getting about Ozempic for weight loss. So thank you to those of you who submit your questions. Please continue to do so. You can leave them in the comments, send them by direct message, or email us at admin@rootscommunityhealth.org. And now over to Dr. Kenji.
Hi, everyone. Dr. Kenji here with Roots Community Health. Here to talk a little bit about Ozempic for weight loss. What is the story with weight loss? It's a question we've been getting a lot. So I figured I'd spend a little bit of time kind of talking a little bit more detail about this new medication. So if you've seen Ozempic in the media, you've seen a rapid increase in public interest. It gained significant media traction and attention in 2021 when it was being used off-label for weight loss, and then finally approved for a weight loss approval later that year in June of 2021. There's also been extensive coverage and discussions from television commercials, social media testimonials, numerous news articles highlighting both its effectiveness for both diabetes management and for weight loss. You'll see the runway model here wearing an I Love Ozempic shirt. That's kind of just to give you a sense of how much traction or attention the medications received. And then also the other piece that we've heard with Ozempic and this type of medication is the shortages and the public outcry that's come from this, because there has been such a surge in demand that's led to significant shortages and this public outcry or outrage focused on the challenges that people who have diabetes face with actually struggling to get this medication because of its demand for weight loss as well. So let's just talk a little bit about how do these drugs work. The main mechanism or the main way these drugs work is through what's called a GLP-1 mechanism, or the GLP-1 agonist. The GLP-1 is a natural hormone that occurs in the body, and it gets excreted or released by the gut in response to food intake. So when you take in food, your body releases this GLP-1. So if you take a look here on the right side of the screen, you have your stomach here right in the middle of this diagram. It releases GLP-1. And it really works across 4 different ways. It works on your pancreas, it works on your liver, it works on your gut itself, and then it also works on the brain. So how does it work across all these different organs? So for the pancreas, it actually causes the pancreas to release more insulin. Insulin takes sugar out of the blood. So what does that end up doing? That lowers your blood sugar level. So you can see why this would be an effective way of treating diabetes, where your blood sugar levels are high. You want to bring down those blood sugar levels. The second way it works is in the liver. The GLP-1, this hormone and this medication, helps decrease the amount of glucagon that gets released. Glucagon, as a result, helps prevent the release of sugar into your body. So if you lower glucagon levels, you have less sugar that gets released into your bloodstream and into your body. Hence, again, another good way to bring down sugar levels for people who have diabetes. The third way that it works here is on the gut. This is a really important mechanism that has to do with the weight loss component, because what it does is it actually slows down your gut. It slows down your stomach and your intestines so that you feel fuller longer. What does that mean if you feel fuller longer? That means you don't eat as much. You consume less calories. The fourth way in which it works is here on the brain. And what that does is it actually works directly on the brain, and it reduces your appetite, which again leads to decrease in your food intake. And you feel fuller again. So this feeling of fullness, this decrease in appetite, helps when you're trying to lose weight and you're trying to take in less calories. So here's a big list of the different types of GLP agonists that these kind of medications that you have here. And I'm just going to highlight a couple of important pieces on this chart here. The first one starred here is called Ozempic. This is the one that is specifically FDA approved for type 2 diabetes. The generic name for it is semaglutide. These are once weekly injectable medications. So you just tiny little needle that you put into generally the skin around your stomach or around your thigh or even your arm, that you can inject this small amount of medication specifically for adults with type 2 diabetes. And it's been shown to be helpful for the heart, for the kidneys, for diabetes, of course, and for weight loss. Now, the same medication here that I'll highlight is called Wegovy, which is just the brand name for semaglutide. So they're actually, Ozempic and Wegovy are the same medications. They're the same generic medications. Wegovy is just at a higher dose, and it is specifically FDA approved for weight loss in both children over the age of 12 and adults. And it works in the exact same way because it's the exact same kind of drug, just at a higher dose. So it's a once a week injection that you put in under the skin to help both with weight loss specifically. And it's just Ozempic, but at a higher dose. And it's called Wegovy. The other thing that I'll mention here too is the other medication that's specifically FDA approved for weight loss called Saxenda or liraglutide. Liraglutide, again, is a injection medication that is used for weight loss, and it's the same kind of mechanism that I talked about before, about how it works both to decrease your appetite and also decrease sugar levels in your body. So how effective are these medications? What's all the hype about? Well, the bottom line is they're very effective for both diabetes and for weight loss. The data for diabetes goes back quite a bit longer to several different trials. I'm going to highlight one trial here just to give you all a sense of how effective this medication was. But this is from a trial called the SUSTAIN trial, SUSTAIN 6. This is from 2016. And what this looked at is, this was from a major journal in medicine called the New England Journal of Medicine, where you had more than 3,000 patients with type 2 diabetes who also had high cardiovascular risk. So the high risk of heart disease, stroke, kidney disease, etc. And what they did was, one group got the semaglutide and the other group got a placebo. And what they saw was a significant reduction in A1C levels. A1C is a way that we track diabetes. And they also saw a significant 26% reduction in major cardiovascular events. So that's things like heart attacks, strokes, and death from cardiac events, from cardiovascular events, compared to the placebo. So it was really a powerful trial because it showed two things. One, not only was it very effective at decreasing your sugar levels and getting your diabetes under control, but it also helped prevent major cardiovascular events. Now, what I'll highlight here, and I'm going to get into this, you're going to see this theme recurring, is the adverse events that we see with these medications are oftentimes related to the stomach and the gut. So nausea, vomiting, diarrhea being big things, being the major side effects from this type of medication class. And you can kind of imagine the way it works on the stomach and how it slows down the movement of the stomach and the intestines, that would be a natural side effect of this type of medication. So helpful for weight loss. Similar to diabetes, the trials are coming out again and again and again, showing that these GLP-1 agonists are very effective for weight loss. And they've been studied in a series of trials called the STEP trials. And so here I highlight just a couple of them. There's a STEP 1, which was a trial in 2021, again in the New England Journal of Medicine. And then there was a STEP 2 trial in 2021, again in another major publication called JAMA. And both of these trials effectively showed that for folks who had obesity with elevated BMIs, that once weekly medication compared to placebo led to significant amounts of weight loss, almost 15% of your initial body weight over the course of about 68 weeks, compared to only 2.4% in that placebo group. That's that STEP 1 trial. So you had a almost 15% loss of body weight versus 2% in the placebo. And the major adverse events there, again, being nausea, diarrhea, constipation, vomiting, those sort of GI-related side effects that we see. And the STEP 2 trial effectively showed very similar results here, where you had sustained weight loss with semaglutide or Ozempic, or I guess at this point, Wegovy, as a result of using this medication. There's some other benefits here too from these trials. The graph on the right showed the decrease in waist circumference in that red line and that higher dose semaglutide group, the group that got the highest level of the medication. And on the left, we are actually seeing physical activity. So again, that red line shows the increase over time of physical activity for those people who got the medication versus those people who got a lower dose in the blue line, or even placebo in that darker line there at the bottom. Okay. So there's other benefits just besides sort of cardiovascular, as well as the sugar levels dropping. You got increase in physical activity because people were losing weight, and you also have an actual shrinking of the waist size for folks as they were losing weight too. So I've touched on this before. Just some of the side effects you're going to hear and probably read about too is really the GI issues, the nausea, vomiting, diarrhea. What I've seen practically with this medications is if you go pretty slow on the titration of the medication and you warn folks ahead of time, these don't typically tend to be things that cause people to stop the medication. And so gradually increasing that dose can really help with the effects of some of the medications that we see. The other medications that your doctors or your healthcare providers are going to be looking at too that are much less common side effects are things like hypoglycemia or low blood sugar levels, particularly in combination with certain medications. So it's really important when you're talking to your healthcare provider, tell them about other types of medications that you're having, that you're taking for your diabetes. Tell them about what your food intake looks like on a regular basis, whether or not you go long periods of time without eating, because those can be important considerations for this kind of medication. And then tell them whether or not you've had issues before with low blood sugar level so that they can keep an eye on that and make sure that it doesn't become an issue. Again, a much less common thing that I've seen clinically in practice when I'm seeing patients, but certainly something to be on the lookout for as a patient yourself. And then the second less common side effect is ketoacidosis. And all that really is that you get high levels of ketones, a particular substance in the body that can build up when your sugar levels get too high. And it's something that your doctors want to be on the lookout for, your providers want to be on the lookout for. If you have other risk factors for, particularly you've had episodes of bad ketoacidosis that have sent you to the hospital before. There's the third thing I'll talk about in side effects is more sort of serious side effects, kind of rare. Some of these are rare, some of these are debatable. You can imagine these drugs have really only been out in clinical practice for the less than 10 years. And so by medical kind of clinical standard time, that's not a lot of time to see what some of the longer term side effects are going to be. So some of the ones that have popped up from these large trials is things like acute pancreatitis. What that means is it causes acute inflammation of the pancreas, which can lead to really bad abdominal pain, and folks can get pretty sick if that's the case. But in most of the trials that I've seen, that's been less than 2 to 3% of the people who participated in the trial. So pretty rare. And then the other thing is gallbladder disease, including gallstones. Again, we haven't completely figured out the mechanism behind a lot of those things. You can understand if it's sort of slowing down the movement of things within your stomach and your GI system, that it could lead to some buildup and some increase in gallstones that tend to accumulate. But again, these are pretty rare, and the side effects for these medications are really still kind of on the horizon. So it's really important to have this kind of conversation with your healthcare provider and go slow and take it easy if you do decide to go down this pathway. The other thing that I talk about here, this is more just for the different types of preparations that you have here, more of a conversation to have with your healthcare provider. But depending on where you are, what the coverage, insurance coverage can look like, particularly for Medi-Cal, a lot of these medications some of these medications are covered for diabetes specifically, and they are covered for chronic weight management. But there may be some additional paperwork that your provider has to fill out and should consider when they're giving you the medication. Some of it being that you've tried other medications before in the past and that this is another good option for you. And some of it too can just depend on what is the local availability of these medications. So that may be something that comes up if you talk to your healthcare provider about these types of medications. So I'm just here talking about other considerations. The diabetes and weight loss, again, they may require some special permission, something to think about with your doctor. And the other question that I get quite a bit always about this type of medication, any medication, is, hey, is this something I can do short term and stop? Can I do it for a few months at a time, lose the weight, and then just kind of stop at cold turkey? Am I going to have to be on this medication long term? I'll say the jury is still out. Most of the data that we have does show that people will regain that weight if they stop it. So there was a trial, the step 4 trial, that showed that half the people who stopped Wegovy or semaglutide after 20 weeks, 70% of that group regained the weight after 48 weeks. So that kind of showed us that if you start it short term and then you stop it, most likely you're going to regain that weight. And then there was another extension of that first step 1 trial that I talked about that showed people who remained long term on that medication, they kept the weight off compared to people who had stopped the medication. So again, just another signal that shows, like, maybe for a lot of people, this is probably going to be a medication you're going to have to continue for quite some time until we figure out other strategies where folks can taper off of it or reduce the dosage that you're taking over time. But generally, when I am talking to patients about this, I'm always going to think about, having folks trial coming off the medication. But generally, we are kind of going into it knowing that this may be something that you have to continue long-term on an ongoing basis, as long as it continues to be tolerated, while you're also building up those other lifestyle habits and other things to help with weight loss and to help with your diabetes as well. So thank you for your time. This a few kind of takeaway points. Hopefully this answers some of your questions, but some bottom lines here are that these GLP-1 agonists, so things like Ozempic, Wegovy, they're very new, but also showing to be very effective for diabetes and weight loss and for reducing your overall cardiovascular risk. So these are definitely things that you should be considering and talking about with your healthcare provider to see if these types of medications do make sense for you. The major side effects that you're going to be looking at, they're very common with these drugs. And I've certainly seen, when I'm seeing patients myself, is around nausea, vomiting, and diarrhea. And again, these can typically be sort of lessened if you start at a low dose and kind of go slowly up on that medication. And then the third thing I'll talk about is these medications, or bottom line here, is that these medications are still expensive. They're new, and they're also in short supply and high demand. They're very effective for diabetes. They're once a week kind of medication, so they're easy to remember to take. And they're also very effective at losing weight, which not only helps folks who have diabetes, but also helps folks who don't have diabetes as well. So really check with your healthcare provider, understand what your insurance situation is, what the costs might be for you, and what the local supply looks like in your area. Well, thank you very much for your time today. And I hope that was helpful in just some 101 basics about Ozempic and these types of medications that are really effective for both diabetes and for weight loss. Thanks so much.
Thank you, Dr. Kenji, for that awesome overview. One additional question that we've gotten a lot is about so-called Ozempic face. So I'm just going to talk about it very briefly because we've heard a lot about it in the media and even almost like accusations that so-and-so must be taking Ozempic because they have Ozempic face. And according to this article in Medical News Today, Dr. Paul Frank, who is a dermatologist to the stars, apparently coined this term, and because he has been treating patients with this issue. And basically what it amounts to is kind of a hollowed out appearance of the face and increased signs of aging, like sagging and loose skin, and an increased appearance of wrinkles. And what it comes down to is that this is really just the result of weight loss, and specifically a result of rapid weight loss, which makes it more apparent that this is happening. So there's actually no evidence that this is a direct side effect of the medication per se. This is really just because it results in rapid weight loss, and rapid weight loss from any method could lead to the same appearance. But because it tends to happen more quickly with the medication, and it just makes it more noticeable. So going slower with weight loss in general would obviously be less dramatic, but the fact is that when you lose fat and lose weight, you will lose some from your face, and it can lead to some of this appearance that people are noticing. So it's still important that you're eating well, you're eating a well-balanced diet, you're getting enough of all of the essential nutrients and essential fats that we all need. Also really important that you don't become dehydrated, because that can certainly exacerbate this appearance. But if you're going to lose a significant amount of weight, regardless of how you do it, this is something that you might anticipate happening. And the only thing to really do to intervene on this would be cosmetic interventions like fillers, if that's the route that you would want to go. But hopefully, whatever you're doing it in consultation with your physician, and we're doing it in a way that is healthy, both physically and emotionally, because we do see sometimes, especially with these things that can seem like a quick fix, that there can be kind of an unhealthy relationship with the process and with one's self and one's body. And that's something we really want to avoid. So if it's possible to reach your weight goals with diet and exercise, that's great. Definitely, if you have diabetes and overweight, these medications may really be the obvious best choice for you in consultation with your doctor. And for all the people in between who don't have diabetes but do have overweight and struggle to lose the weight, this could be a good option for you as well under the guidance of your physician. And like I say every week, if you don't have a primary care provider, please get one. Don't wait until you need one to try to find one. Know how to reach them before you need them. Establish a relationship with your primary care provider. Get your blood pressure checked, your baseline labs like hemoglobin A1C, blood sugar, cholesterol. Get the appropriate cancer screenings for your age and risk factor. Know where you stand. And remember to eat a balanced diet, incorporate fresh foods, avoid sugary drinks and processed food, get some regular physical activity. Unless you don't feel well, in that case, please get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us. We'll see you again next Tuesday at 10 a.m.